Go ahead, ma'am.
Good evening, everyone. I am Dr. Prinka, Fertility Specialist at Oasis Banashankari, Bangalore. I welcome you all to today's Facebook Live session where we'll talk about when to do IVF. Now, before we discuss about IVF, let's talk a bit about how the natural conception occurs. So, naturally, an egg is released from the ovary, that is called ovulation, which is then picked up by the tubes. And then the sperm, which is deposited in the vagina, it swims up to the uterus and then to the tubes. And then fertilization takes place in the tube. So, if there is any fault at any of these levels, then fertility issues may arise. And 30% of the cases of infertility are due to female factors, 30% due to the male factors, 20% may be due to the combined factors, it is both male as well as the female factors, and the other 20 to 25% of the cases may be due to unexplained causes. IVF means in vitro fertilization, that is, fertilization outside the body. IVF has provided success in a lot of couples with an ever increasing rates of success per year. We have been able to serve more and more couples with expanding indications for IVF. So, see, but not every couple who is facing fertility issues need IVF. A vast majority of couples, they do get pregnant with simpler procedures like ovulation induction with the ovulation induction medications and then monitoring their cycle to know when is the right time for ovulation, and also like IUI or laparoscopic procedures, etc. But there are some couples who need IVF only to get pregnant. So, when do we need IVF? See, there are some absolute indications for IVF when there are no other options. That is, IVF is the best option in such cases. But there are some other indications also when IVF is more beneficial. So, one of the absolute indications for IVF is when both the tubes are blocked. Now, as I told you earlier, that the eggs and the sperm they travel to the tubes and the fertilization takes place in the tube. So, if the tubes are blocked, then fertilization cannot take place. So, in that case, IVF can be the only option to get pregnant. Tubes can get blocked due to various reasons, like if there are any pelvic infections, or if there is history of genital tuberculosis, if there is distorted pelvic anatomy, or due to some adhesions, or if a woman has undergone any tubal sterilization procedure before but now wishes to get pregnant again. So, in such cases, IVF is very helpful because in IVF, the location of fertilization is changed. That is, instead of the tubes, the fertilization takes place in a dish in an embryology lab. Then, another very important indication for IVF is if the male partner has very low sperm count or very low motility, or majority of them are abnormal sperms. See, if the sperm count is very low or the motility is very low, then the simpler procedures like IUI may not be helpful. And IVF is better in achieving pregnancy in such cases. Even even if the male partner does not have any sperms in the semen sample, even then IVF can be done and pregnancy can be achieved. See, sometimes what happens is that there may be a block in the outflow tract, that is, the sperms are being produced normally in the testes, but there may be a block somewhere in the outflow tract, or there may be a hypofunction of the testes. So, in such cases, the sperms can be aspirated directly from the testes and then they can be injected into an egg to prepare the embryos. So, IVF has made it possible to achieve pregnancy with one's own gametes, even if there are zero sperms in the semen sample. Then another indication for IVF is severe endometriosis. Now, what is endometriosis? Endometriosis is a condition in which endometrial tissue is deposited anywhere outside the endometrial cavity. It creates a very hostile environment or a very unfavorable environment in the pelvis, which it can cause distortion of the pelvic anatomy due to the adhesions between the various organs, and it can cause blockage of the tubes, can produce chocolate cysts in the ovaries. It can even affect the quality of the oocytes and can interfere in the implantation of the embryos also in the endometrium because of the rise in the inflammatory mediators. There are many theories as to how and why the endometriosis occurs. Like one of them is due to the backflow of the menstrual blood. So with every menstrual cycle, the size and the number of the chocolate cysts may increase and the adhesions may increase, which may need laparoscopic surgeries. So, for such patients with severe endometriosis, it is better to try for pregnancy as early as possible because, in order to avoid, because in the sense in these patients, the quantity and the quality of the oocytes will keep declining, and also in order to avoid repeated laparoscopic surgeries. Then, one more indication for IVF is unexplained infertility. Unexplained infertility is a very intriguing as well as a very frustrating condition for both the couples as well as the clinician because at the gross level everything appears to be normal, like the woman is having normal ovarian reserve, she is ovulating at the correct time, the tubes are open, the uterus appears normal, the male sperm parameters are also normal, and yet the couple is unable to achieve pregnancy. So, microscopic world of an IVF lab has given an insight into some of the causes of unexplained infertility. There are many things which we cannot know at the gross level, like we do not know the quality of the oocytes or the eggs. We cannot know whether the fertilization has actually taken place or not. So, in such cases of unexplained infertility, who have tried simpler procedures like IUI and has not been successful, IVF is the best solution. Another one more indication for IVF is resistant PCO cases. In these patients, they have a lot of follicles. Number of follicles is more, but there is severe ovulatory disorder. These patients they do not respond easily to ovulation induction drugs, and there is also a risk of ovarian hyperstimulation if the higher doses are given. So such patients also IVF is a better option. Then, on the other hand of the spectrum, there are patients who have very low ovarian reserve or premature ovarian insufficiency. Now, see, every woman is born with a fixed set of oocytes, which keeps declining as the age advances. Not only the quantity, the quality of the eggs also keeps declining. So women with low ovarian reserve, they do not have a lot of time to waste. So IVF gives the best solution in such cases. Some women they may even need donor oocytes because of the premature ovarian insufficiency, or their reserve may be too low. So in that case also IVF has to be done. IVF can help in preparing the embryos by fertilization of the donor oocytes with the husband's sperm. IVF is also needed in patients who need surrogates. That is, if they have any severe uterine abnormalities like intrauterine adhesions or resistant thin endometrium. In such cases, the embryos can be first prepared with the help of donor oocytes, no, not sorry, donor oocyte, with the help of patient's own oocytes and the sperm of the husband, and then these embryos they can be transferred into the surrogate's uterus. IVF is also indicated in patients who have been trying for many years and with simpler procedures and they have not been able to achieve pregnancies, like multiple ovulation induction failures or multiple IUI failures, etc. Then there are some special conditions in which IVF is needed. Like suppose if the couple is having any genetic defect or if any genetic disorder is running in the family or if there is any history of recurrent unexplained pregnancy losses. In such cases, IVF with PGT, that is pre-implantation genetic diagnosis or screening, is the answer. This means that IVF is done, embryos are prepared, and then these embryos are tested for any genetic defect. And then only the genetically normal embryos are transferred into the uterus. Another special condition in which IVF is needed is when the woman is having any cancer and she needs to undergo chemotherapy or radiotherapy, which are gonadotoxic and that they can pose a threat to her ovarian function. So, in such cases, before going for chemotherapy or radiotherapy, women can cryopreserve their oocytes or embryos beforehand and then go for embryo transfer at a later date. See, oocyte cryopreservation is also a viable option for women who want to delay the childbirth. Nowadays, women are becoming more career oriented. They may wish to delay their childbirth. But as the age advances, the number of oocytes will keep declining. So they can cryopreserve their oocytes before for future use whenever they wish to get pregnant. See, IVF is a very helpful and an advanced scientific technique which has helped lakhs of couples across the globe to get the joy of parenthood. But there are many myths surrounding the IVF. Some people feel that IVF children are not normal, like the normal born children, but it is not so. They are as normal and as healthy as the children who are born through spontaneous conception. Some women feel that they have to give up their careers and jobs because complete bed rest will be needed after IVF. But that is also not so. You can continue with your jobs and because complete bed rest is not advised and not needed after IVF. Some couples feel that cesarean is the only mode of delivery once IVF conception is there. But that is also not so. You can have a normal delivery and cesarean may be done only if there are any obstetric complications, just like in spontaneous conception. So, for women who have been facing fertility issues, who have been trying for many years and have not been able to get pregnant, IVF has come up as a boon where 50 to 60% chances of getting pregnant are there. And so I would like to advise women that whoever needs IVF, they should not lose much time because as the age advances, the success of IVF also comes down. So please, if you do need IVF, then go ahead with it, make a decision because overall IVF is a very safe procedure. Thank you. I hope that the session has helped you in some ways. If you have any questions, please write in the comment box below. When should we do IVF treatment? So as I told you that there are many indications for IVF, like if both your tubes are blocked or if the male semen parameters are very abnormal, like if there is very low sperm count or morphology or motility, or if there is severe endometriosis in cases of unexplained infertility, or if there are multiple failed cycles of ovulation induction or IUI, and then some special indications like where PGTA is required or in cancer patients, etc., you can go ahead with IVF. When should I start thinking about IVF? See, it's not about you should start thinking about IVF only. If you are having any fertility issues, then please meet your fertility specialist first. Get yourself evaluated. And not only the female, both the male as well as the female partner should get evaluated. And then, depending upon your evaluation, your results, your tests, whatever best option is there for you, your fertility specialist will definitely advise you. Not every couple needs IVF. How successful is IVF on the first try? The success rate of IVF is about 50 to 60%. What causes miscarriage after IVF? See, it's not that IVF itself causes miscarriage. Miscarriage can occur due to any other reasons also. So it may be due to some genetic defect in the baby itself or due to any other reasons also. So it's although the chances may be a little higher, but it is not due to IVF itself. Is IVF better than natural conception? See, there is nothing like natural conception. But if you're not able to achieve that, then IVF is your best goal. So I would like to conclude here. Thanks for your patient hearing. And if you have any queries or any other help is needed, please feel free to contact on our helpline number given below, or you can meet us physically at our Oasis Center. Thank you.